Let me say this as clearly as possible. If you turn the NHS into a data experiment run by Palantir Technologies, you are not modernising healthcare. You are gambling with people's lives. There's a debate happening in the UK about bringing in Palantir-style systems and embedding them deeper within the NHS. No vote, just vibes apparently, and I have several concerns. So let's break it down. Number one, AI is not a doctor. AI works on patterns and healthcare works on people, and people, they are messy and complex and contradictory, especially if you happen to be chronically ill, disabled, neurodivergent, or, just not a textbook. AI doesn't get nuance. It doesn't clock tone or trauma or the way your symptoms don't behave like they're supposed to. Doctors already miss that stuff sometimes. More than they should. Now imagine adding a system that literally cannot understand it into the mix. That's not innovation, that's risk. 2, bias gets hard-coded, okay? Let's not pretend that the healthcare system is bias-free. We've got medical misogyny, we've got racial disparities and chronic illness being dismissed left, right and centre. Now take all of that and feed it into an algorithm and congratulations, you've just automated discrimination, except now it comes with charts and confidence scores and suddenly it actually looks objective. That is not progress. That's automated medical gaslighting with a spreadsheet. Number 3, you cannot separate healthcare from trust. When you go to the NHS, you tell them things you wouldn't tell your own family, okay? Mental health, trauma, abuse, the most vulnerable times of your life. Now ask yourself, would people feel safe sharing that, knowing their data is sitting inside systems built by a company with deep roots in surveillance and government work? Because if patients stop being honest, then care falls apart immediately. 4, ethics are not optional in medicine, okay? Public healthcare should be built on trust. So yes, who you partner with does matter. If a company has controversial global contracts or ties to military surveillance work, then putting them in the centre of the NHS infrastructure isn't neutral. It affects public confidence, community trust, and whether people even feel comfortable engaging with care in the first place. This isn't about being political. This is about protecting the integrity of public healthcare. Number 5, function creep is how this gets worse. Today we're just improving efficiency, but tomorrow it's scoring patients, prioritising access, predicting who's worth treating in the first place. And the scariest part is you won't even see it happening. Because once these systems are embedded, they become hard to question, harder to remove, and almost impossible to challenge as a patient. That's not healthcare, that's decision-making that you cannot appeal. Number 6, cost is not the main issue, but it's still an issue. Yes, it's expensive. Yes, it's public money. Again, going into private tech contracts. And yes, it risks long-term dependency. But even if it saved millions, it would not and could never justify worse outcomes, less trust, and more harm to vulnerable patients. Because healthcare is not and never should be a budget exercise, America. It's people's lives. The NHS doesn't just treat data.